So as a respiratory therapist, our job is to help people breathe from a baby's first breath of life all the way up until somebody's last breath. During the COVID-19 pandemic, our role has been to assist people in breathing and getting oxygen into their lungs. Specifically, we've been heavily involved in helping intubate and then keep these people on a ventilator and help them breathe a little bit easier until their body can get better. So on our mind right now, we are just hoping that we continue to see people getting better, and also that people are following the rules, staying safe at home, and helping stop the spread still. I've been feeling pretty good now. I'm a bit more optimistic now that BC has done a really good job at flattening the curve. Initially there was a lot of fear and anxiety coming to work. Just a lot of things were changing very quickly. We were having to think on our toes and just adapt very quickly. But things are definitely more routine now, and definitely having people stop the spread and flatten the curve has helped us immensely. Most important right now is for people to continue to be safe, be smart, stay at home, take care to help continue to flatten the curve and follow the guidelines put out by BC. Right now in hospital, we're still doing our best to catch up and keep people safe and healthy for any needs that they might need in the hospital. Success right now looks like just managing well in the hospital, keeping our numbers as low as we can, continuing to work really well as a team. We've really seen a dynamic unit of all different healthcare professionals working together, doing a lot of teamwork, which helps lighten the load on everybody. Success outside the hospital, I think it's really important that we continue to keep the numbers low. And just help as much as we can to keep everybody in the community safe and out of hospital. So part of planning for the pandemic involved a lot of just thinking with coworkers, with other team members, putting into place protocols, researching, making sure that everything that we would be offering to patients in terms of therapies was safe for the patient and also the staff that was coming into contact with those patients. So a lot of our job was planning in terms of doing simulations, doing research, reviewing our protocols, spreading information among other healthcare providers. And that was a really big job at first. Now things are more in place, people are comfortable with the protocols, that it's a little bit easier, but definitely like thinking through things before we did them, double, triple checking everything to make sure everybody was safe going into the room. So I definitely want to thank all the people that I work with, all the respiratory therapists, all the other healthcare professionals that have really made coming into work definitely more enjoyable. I'd like to thank the community for doing their part. Definitely all the people that come out and cheer for us at 7 o'clock. It's so heartwarming to see people taking time to come and thank us and clap when really they're the ones that are doing such a good job staying at home and making our jobs easier in the hospital. I'd say the most profound impact that I've had is just really seeing how people pull together in a time of need. Whether it's in the hospital, all the healthcare providers working as a team, all of my coworkers coming together to help out, or just the community on a larger scale, everybody helping out, providing meals, donating, just showing up with virtual support. I think that's the most profound thing that I've come, is just a sense of community that we're seeing. So a really nice moment that I've had is there's been a patient who was COVID positive and was intubated, which I was a part of, and we took care of them for weeks in the ICU, and I was able to eventually extubate them and have them go home, which was such an important moment to see somebody so vulnerable, so sick, and then get better, extubate them, take the breathing tube out, and see them go home again. And it just gives a lot of hope that we are making a difference, people are getting better, and what we're doing is helping